Hello, Diaz here, founder owner Greenwood Dental. Welcome back for another episode. Today, I would like to talk about the difference between bone growth and tooth eruption to answer many of the questions that a lot of the parents that come through our office are very anxious about or confused about or very uncomfortable as far as making a decision when the child will need to have braces or if their child needs braces or tooth alignment or tooth movement or Invisalign. So remember, the information that I put through these videos are meant to be a tool as a reach out program for some of you that's still not comfortable coming in the office because of the worldwide bug. And I hope these videos are informative enough to give you a better understanding of certain things that you might be thinking of or going through to make the right decisions for you. So my observation, and this is just my objective opinion, is tooth eruption and jaw growth, it's almost they are two different programs that don't communicate and they're not connected. To put it into perspective, basically, we have seen many cases, or in general, the majority of the cases, that the teeth might erupt sooner or faster than the jaw will grow. And what that ends giving you is more of the crowding that is favorable for the child. And when you have crowded teeth, the bite is not correct, the alignment is not correct, their chewing is difficult, and also their pronunciation is a little bit difficult until everything's straightened out. If the jaw grows way before the tooth erupt, then you'll have a lot of spacing, and then we have to close the space, or we have to wait until the growth is completed, and then we can correct the alignment. So all I'm saying is that we don't have a way to make the genetically programmed eruption rate match the genetically programmed jaw growth. Some patients are lucky enough that the eruption rate and the jaw growth, they're at the same speed or the same rate, and those are the patients end up with a naturally straighter teeth. But when you have the two programs are lagging or they're not catching up with each other, that's when we get the discrepancy in the tooth alignment, and as a result, the child will have to start with a retainer or will need an ortho consultation at an early age or need to see an orthodontist. So the broad spectrum of when the eruption happens and at what rate comparing to the jaw growth, that will determine when the patient needs to see the orthodontist or get an evaluation or consultation by an orthodontist. My practice, personally, I practice very conservative, and I like to listen to the body, and I like to review with the parents the growth rate, their height, their weight chart every time they come, and observe the change or the rate of change as they are growing. That gives me a better idea in which direction they're heading, and also a better idea to determine when I have a solid position to recommend orthodontia or tooth alignment appliance or tooth movement. So if you have a question about why the teeth are crowded, that means that the eruption rate is faster than the jaw growth. If you have a question why they have so many spaces, it means the jaw growth rate is a lot faster than the teeth erupting. Why these two are not connected, I personally don't know. I haven't Googled it. I'm not sure if we have a science or data that shows us or says why. All I can think of is genetics. A lot of it is connected to how we are made, or if we have picked up a recessive gene somewhere from the gene pool. I hope this helps out, and I hope that clarifies some of the questions or some of the concerns that some of the parents have regarding the tooth alignment that they see, or the signs of crowding or too much spacing in the mouth as the child is growing. Be well, be safe, DS out.